Swollen stomach, causes and prevention. Most people experience abdominal swelling or bloating at some point due to various causes. It feels as though the stomach has expanded and stretched, which can be uncomfortable. Having too much to eat or consuming food that causes gas can cause temporary swelling in the stomach. However, if the swelling is frequent, it may indicate a dietary issue or be a sign of a more serious underlying condition. Common causes and treatment. Some of the possible causes of a swollen stomach, along with their treatment options. Irritable bowel syndrome. Irritable bowel syndrome is a chronic gastrointestinal disorder that causes symptoms such as bloating, stomach pain or discomfort, constipation or diarrhea. According to the American College of Gastroenterology, the cause of irritable bowel syndrome is unknown. However, the American College of Gastroenterology note that people with irritable bowel syndrome tend to have higher levels of sensitivity in the intestines than those who do not have the condition. Treatment. There is no cure for irritable bowel syndrome. However, the following home treatments may help alleviate the symptoms. Avoiding or limiting gas-producing foods such as fructose, a fruit sugar, lactose, a milk sugar, beans, onions, cabbage, broccoli, carbonated drinks, sugar substitutes such as sorbitol and mannitol. Eating foods more slowly, avoiding overeating, introducing more fiber into the diet, but doing so gradually to avoid aggravating bloating. Lactose intolerance. Lactose intolerance is a digestive disorder in which a person is unable to digest the sugar lactose, which is present in milk. A person with lactose intolerance will develop uncomfortable or painful symptoms within a few hours of consuming milk or dairy products. These symptoms may include stomach bloating, stomach cramps and pains, stomach rumbling, gas, flatulence, nausea. The severity of the symptoms varies depending on how much lactose a person has consumed. Treatment. The best way to prevent the symptoms of lactose intolerance is to avoid foods and beverages that contain lactose. Alternatively, people can try taking lactase pills or capsules before eating a meal that contains lactose. The enzyme lactase helps the body digest this sugar. Serious causes. Some of the causes of stomach bloating are more serious. They include cirrhosis. Cirrhosis is a condition in which functioning liver cells become replaced with non-functioning scar tissue. Liver scarring can cause increased blood pressure in the blood vessels surrounding the liver. This in turn can cause fluid to accumulate in the abdomen. The causes of liver disease range from underlying medical conditions to the long-term overconsumption of alcohol. Treatment. The treatment approach for cirrhosis depends on its underlying cause. In most cases, it is not possible to cure cirrhosis. However, the following lifestyle changes can help a person manage their symptoms while preventing the disease from progressing. Avoiding alcohol, quitting smoking, losing weight if necessary, performing regular exercise to maintain muscle mass, practicing good hygiene to reduce the risk of infections, talking to a doctor about any necessary vaccinations, People can reduce stomach swelling by cutting salt out of their diet. They can also take a diuretic to help fluid drain from the body. Autoimmune diseases. In people with autoimmune diseases, the immune system mistakenly attacks and destroys healthy cells in the body. Autoimmune atrophic gastritis is an autoimmune disease in which the immune system destroys parietal cells in the stomach. These cells make stomach acid, which the body requires to absorb vitamin B12. In autoimmune atrophic gastritis, the gradual loss of parietal cells can lead to iron deficiency and vitamin B12 deficiency. The possible symptoms of autoimmune atrophic gastritis include a feeling of fullness in the upper abdomen after eating, stomach pain, nausea, vomiting. The cause of autoimmune atrophic gastritis is unclear, but people may be at higher risk if they have autoimmune thyroiditis, type 1 diabetes, Addison's disease, an endocrine disorder, vitiligo, which is a lack of melanin in areas of the skin. Scientists also believe that the condition might have a genetic factor as it seems to be heritable. Treatment. The treatment for autoimmune atrophic gastritis involves addressing any nutrient deficiencies. People with iron deficiency may require intravenous iron infusions, while those with vitamin B12 deficiency may require vitamin B12 injections. Congestive heart failure. Congestive heart failure is a disease that reduces the heart's ability to pump blood around the body. This impairment causes blood to build up in the chest. The fluid may then seep down into the abdomen, causing stomach swelling. Other possible symptoms of congestive heart failure include persistent coughing or wheezing, shortness of breath, increased heart rate, tiredness, fatigue, nausea, lack of appetite, confusion, impaired thinking. Congestive heart failure generally develops as a result of other conditions such as high blood pressure and coronary artery disease. Treatment. The treatment of congestive heart failure may involve one or more of the following: lifestyle changes such as quitting smoking if relevant, avoiding or limiting alcohol and caffeine, being physically active, eating a heart-healthy diet, managing stress, surgery. Other causes. There are many other possible reasons why a person's stomach might swell. According to the International Foundation for Gastrointestinal Disorders, these reasons include high salt intake, hypersensitivity to the digestive process, imbalance of gut microbiota, small intestinal bacterial overgrowth or SIBO, gallstones, a blockage in the intestine, an increased curvature at the bottom of the spine which reduces the space for gas in the abdomen, edema due to some types of cancer or cancer treatment. Diagnosis. If a person experiences severe or persistent stomach swelling, their doctor may run one or more of the following tests to identify the cause. Fecal analysis, blood test, abdominal x-rays, barium swallow test, which uses x-rays to image the esophagus or food pipe while a person swallows food, barium enema, which uses X-rays to image the lower intestinal tract. Gastric emptying scan, which is a test to determine how quickly food exits the stomach. Endoscopy of the upper gastrointestinal tract, which involves the use of a flexible scope to image the upper GI tract. Prevention. If the stomach regularly swells after a meal, a person should consider eliminating gas-producing foods from their diet. Foods that cause gas include food that contains starch, such as potatoes, beans, particularly pinto or baked beans, cabbage, Brussels sprouts, asparagus, broccoli, artichokes, onions, apples, prunes, carbonated drinks. When to see a doctor. A person should see their doctor if they experience severe, persistent, or recurrent stomach swelling, especially if other symptoms accompany the swelling.